Good afternoon, can everybody hear us?
Yeah.
Sorry for being delayed and started. Did everybody online?
I can hear you, Lynn.
Okay, perfect. Thank you. So again, apologize for the short delay and starting. Welcome everybody to Megan. Welcome everybody online. I just want to start off, first of all, of course, to remember our dear dears week from Virginia. With the unexpected loss of her this past week. Everybody knows what a dear friend she was, but the leadership and compassion she had with the whole state of trauma. And what I hear over and over from different people I talk to is what a mentor. And she touched everybody deeply. Today's gonna be hard. And tomorrow that we have each other and just lay on each other and we'll continue to pray for her and family. If we could just take a minute of moment of silence for her. All right, we're gonna get you. Okay, again, welcome to our meeting. So we'll start.
So our first item on the order of business is to establish a quorum. So we just need to make sure that we have attendance from the representatives to the community leaders. So education chair, will we give a minute? Are you online?
What?
Oh, good. Pediatric subcommittee chair, Kelly Riker. Process improvement committee chair, Renee Stevens or Ashley Bolton. New present online.
This is Rayma, I'm on.
Good, thank you. And registry subcommittee, Sue Kelly. Here. Then we have injury prevention committee, Crystal, had an emergency and will not be present today. So, Chair, you have a quorum. I guess the next item of business is to approve the minutes from the May 8th meeting. Has everybody had a chance to review the minutes?
It's super hard for us to hear on the phone, just FYI.
Is this better? Can you hear me better now?
Yeah, that was better.
Was that a yes?
Yes.
Okay, thank you. Okay, so were there any changes or recommendations between amendments to the May minute meetings? Do we have a motion to approve the May minute meetings as presented? Kelly moved, and I see that we have a second online. Pending, barring any discussion, we'll just go ahead and accept those minutes approved as presented. Minutes.
Thank you.
Our final introductory order of business is just, are there any new members with us today, either in person or online?
Yes, Janie Hinton from Southern Regional.
Welcome.
Thank you.
Heather Loftus from Spalding, Wellstar.
Good to have you. Thanks for joining us.
Donna Gonzalez from Southern Regional.
Glad you're here. Okay, well, welcome to our new members, and I guess it's time now to formally move into the business of the meeting. Thank you.
So first up, we have Kim and Chuck from Life Link's going to give us a brief update.
There's not like a camera, is there?
I don't think so. Yeah.
No, I don't think so. How do I click? Or just tell you to click?
Yeah, she's actually online.
You can just say Meg.
Oh, gotcha. Okay, great. Good afternoon, everybody. Chuck and I are here today to give you just a brief life link update. First of all, we want to also express our sympathy to this group for the loss of Regina, who has been instrumental for us as well in our involvement with this committee. Certainly the work in Augusta. Tony Cooper, our liaison there, was the one who reached out to me to let me know, and I know that they were very close as well. I was telling Liz earlier that for as long as I've been involved in this committee, like there was Regina's case, right? Amazingly talented and gifted academically, but also just always that shining, fun and really have personality. So let's go out as well. I also would like to acknowledge that apologies for discussing mortality at the top of this meeting. And it's a very solemn meeting, but we did want to share some brief numbers with you, so we won't give on today. And
It was important to her, Kim. Yes, important.
Yeah, and actually one of our biggest advocates as well. So as they said, when we walked in the door of this meeting, for this meeting, I think it was Gina that said, we talked about canceling, but that would just make her mad. So we're here to keep doing the work that we do. So just a couple updates. For us, our fiscal year goes through June. So we're sharing our fiscal year data from July of 2020 through June 30th of 2025. And it's broken down a little funny on this graphic. That's just the way our BI works, but it's also sort of interesting because we're talking about this time frame. I mean, you may remember when we were here a meeting or two ago talking about how donations from trauma were really down and we weren't quite sure what was going on, and hoping that overall process was just better. But I think trauma in general kind of took a dip for a while. And so when you see the left side is 2024, the right side is 2025. The blue is the current, and then green is the prior, so the year before. And what you'll see is that most of that deficit, if you will, or that behind, particularly for the donors, if you look at that audience square, happened in the first half of our fiscal year, and in the second half of the fiscal year, our trauma organ donors have actually increased over the previous time frame. So Chuck has been going to a lot of meetings throughout the state. We've been talking to a lot of people. And we've been hearing that it really does mirror what seems to be happening in the trauma community, that there was a dip in overall trauma that seems to correspond with a dip in mortality, also then a dip in donation. So that's, I guess, kind of helpful, gives us a little bit of perspective on why we're seeing the numbers that we are. The one thing that I think jumps out to us the most in terms of why are we back up is that in 2024, gunshot weapons were down for us pretty substantially, and there seems to be a rise in gunshot weapons again, contributing to some of that increase. That's just kind of our 2 cents on what we'll see. And if you go ahead and jump to the next slide, then you can see this is the calendar year to date. So some of the same numbers, January through the end of July. Again, pretty even on referrals, and referrals kind of does reflect what trauma volume is, or trauma mortality anyway, is like for you guys, so pretty flat there. And then an increase from the previous year in overall donors. And the next slide. So this is interesting. Again, after having a couple conversations, particularly with some folks at the Children's Hospital recently, I decided to go back and just sort of map out what it's been like for us over the last 5 or 6 years. And again, I'm not really sure what happened in 23, but I think it reflects what you all were seeing in your facilities as well. That 23 was really a really active year for us, and then so it made kind of that downfall in 24 seem even more substantial, and again sort of a leveling out so far in 2025. Next slide. So I won't go over this in great detail, but this is the fiscal year, and then the next slide is the calendar year of 2025 by hospital. And so you guys may remember this, those who've been around for a while. This is something I used to do by hand in a really long spreadsheet. But everybody likes comparison, and I have to say, my boss, when I was showing the slides, was a little bit like, "You're going to show them?" Like, yeah, why not? But it's the numbers, right? Transparency. But what this reflects is the total referrals that we've received by hospital, the number of those that were then to potential organ referrals, donors from that institution, and then the BD and DC, so brain dead and death by circulatory death, and then total organs that were transplanted. And then that's not only organs transplanted for donor. And this is again specific to trauma.
So, you can see, I'll give a shout out to Madison since we're here in Macon, and that's Chuck's facility. On the organs transplanted for donor that, I don't want to get that wrong. 6.4 organs transplanted for donor for us is a huge number. So that really does reflect some work that they've done in terms of how we manage donors throughout whether it's brain process or DCD, make sure that we maximize what we've transplanted. So this, I think, is in the attachments or the minutes, right? Everybody will have access if they want to see those. So I won't read them all to you, but again, most of fiscal year and then calendar years will be annual allocations. And then the next slide is tissue. And this is something that Chuck and I have been talking about, is that we always spend so much time talking about organ, but tissue donation is important as well. Obviously, the process is really different, but we wanted to just acknowledge that. There are oftentimes that trauma donors aren't on a ventilator when we get that referral, and the tissue is still an option. So we have had through managed July 30 donors from 30 tissue donors from Cardiac Bus versus 29 in the previous year. And I just took this a little graphic here because, again, we spend so much time talking about the organ donation process because it's so involved. But tissue is pretty amazing too, right? One tissue donor can benefit up to 75 people through different types of grafts and things that are made. So shout out for those donors as well. And then I think just one more slide, which is just to let everybody know that we do have donor resource training coming up. So please take this back to your staff again. You'll get those slides. That on October 30th, this is a virtual program. It's 5 hours. We do offer contact hours as well for you to register. And this is, if you haven't been through it yet, it's kind of the start to finish of our whole process. So just an in-depth understanding of when to make referrals, how referrals work, what the evaluation process good works like, organ placement, the whole gamut, and a little short 5-hour session. Chuck, anything you want to add?
Thank you.
Okay, any questions? All right, well, thank you all for allowing us to be here.
Thank you. Thank you very much. That was great information. I appreciate the tissue donor following that too. That's just another great reason to for organ donation. Yeah. Fran, are you? All right. So next up, we have the water trauma information updates, please.
Thanks again, Lynn, for just mentioning Regina at the top of our meeting. I know this has been a time of profound loss for me personally and professionally, and I am just so glad to be here with all of you, and know that we'll be together tomorrow because it's helping. It really is. We have such a, I was just talking with Dr. Bolger, who's presenting tomorrow, and just said that I don't know how we go through something like this without the team that we have, and it's just amazing. And Regina would say that you can't shut me up anyway, so I'm going to talk whether here or not. So anyway, here we are. So just a few updates for you guys to talk about. The ICD-10 training course is coming up. We do not have the books here today. Gabby, did you have anything you wanted to mention about that?
No, we are waiting on that purchase order in order to fulfill the book payment. So we're trying to come up with a plan B for book distribution. So more to come on that.
We've talked about a couple options. We'll make sure you get the books. Okay, so we're committed to making that happen. So I just don't want anybody to stress after that. I mean, this is big, and we're really pleased to be able to bring the course to you. The level 1 and 2 readiness cost survey, I'm also going to turn that over to Gabby, but just a reminder that the deadline for that is September 30th. And the reason that we have to have everybody's data in is because we're going to have Warren Averett, Justice Story, who's been doing these reviews of our readiness costs since the dawn of time, since we first started with those. She's going to try to crunch the numbers and get us a nice summary before the legislative session. So it takes a while to do that because, as you know, there's sometimes she has to have some back and forth guys over that. So Gabby and I talked about please make sure you're checking our webpage for readiness costs, because there's a wealth of information. And with the last webinar, folks are now getting into the nitty gritty, so they have submitted a lot of questions, and so we've updated the FAQs. There's a lot of really good questions that have come up. And, we also want to make sure that you're on the right version of the survey, because we have had a couple updates. Now, Gabby and I agree that within 30 days of the due date, we're gonna lock it down, we're not gonna make any changes to the survey. And probably the last change we made is gonna be the last one, and it's just that we eliminated the blood product requirement, because there was just no way to come up with a readiness cost estimate for that. I mean, you have, tertiary care facilities have to have blood and blood products for the other service sites that are in the hospital, so it's really hard to quantify what is your true readiness. And since you get paid for blood and blood products out of a DRG, you have to back all that. It's just messy. Yeah, being accountants were not too happy about that. If somebody came up with a novel idea with how to do that, put it out to the side in that comments section. I want to look at it. I would love to crack this nut, but it's not going to happen. I just don't think there's a way to do it. And maybe when we redo the level 3 and 4, because I think level 3s are required to have platelets, which is a little bit of heartburn because you don't use them a lot, and that's a cost when you shave your head. So when it comes to that, we might be able to quantify that. For 1s and 2s, probably. So we're going to eliminate that, and just make sure keep for your finance folks. And I just had a call with the center recently who had several questions that they wanted to go over, but the basic tenet is that go back to the gray book and look at the context in there, because Dr. Ashley will always say these are supposed to be conservative costs. So we know that sometimes you pay extra for this or that or whatever, but this is, or maybe you have something that you don't need to have, but this is bare bones. Like, we can actually say this is the minimum of what's required. We're not getting every little thing. So that's what makes this really strong, is that these are conservative estimates. So if you add all the other stuff that you have, which you probably don't need, but when you take care of your patients, the cost is quite significant. Anything else to add, Gabby?
Nope, I had some slides in the packet if you want me to review it real quick.
Yes.
Okay.
Katie, if you want, yeah.
Next slide. As Liz mentioned, the survey does reflect the 2022 gradebook standards. So we just wanted to emphasize that that is a great resource if you are confused about any of the costs on the survey. Next slide. The next webinar we have is September 19th at 10 a.m. That will be the last drop-in webinar. And we do have the resource hub available on our website. It has the updated FAQ, recordings, and also the registration link for that upcoming webinar. Next slide. And Liz already mentioned the latest update is the blood product cost removal. So on the updated survey, that should be crossed out. Next slide. Here are the updates to date. There's been an update to line 50, just for clarification. ECMO was added, and costs reported should be for emergency cardiac surgical care. We've added a new calculation, option D, to medical personnel and services costs. Pediatric level 1 and 2 center updates include line 31 was clarified with child life administrative duties. We also added line 129 to include child life specialists and associated program cost. There is also a calculations example sheet. And then again, the blood product cost was removed in the latest update. Next slide. And here is the timeline. You'll see you are here under optional webinars. And the last one again is September 19th. The survey is due September 30th. And then after that, we'll have data validation and audits through October and December. And then we should have the final report ready by January 21st of 2026. Next slide. And then this is the survey submission reminder that the survey is going to be submitted through Warren Averett Connect. So please email jessica.story@warrenaver.com the names and email addresses of your facility contacts so that you can submit that survey through that proprietary file sharing site. Next slide. And then for the submission, you will submit the completed assessment, which is the Excel file, your signed signature page, and then your CY 2024 organization chart. Next slide. And here's our contact information. Please submit any general questions to me. And then Warren Averett if you have any submission questions. And that's all I have.
Let me know if you have any questions or any help with your logins for that. Also, we are, as I said, we have our meeting tomorrow. We recently sent out the first ever scorecards to everybody out of Arborimetrics. This was Dr. Amchi's idea. So we worked with Sarah to make that happen. So we'll be doing a millimeter and asking for some feedback. And our hope is really just to give you a little taste. Our goal will be to add all the PVP metrics, our metrics, and get those to you every quarter so you know where you stand, and hopefully also drive you to the site because you want to know more, right, about what you're said. And AMG's putting together a lot of data tomorrow to share from the site, so looking forward to that. I know we've talked about Regina a lot, but I want to add, you know, she really liked playing with Arborimetrics and the data. And I agree, you know, she would want us to push on and do this project. I wanted to let y'all know that we do have a book that we set up, and we may pass it around the room. Our goal is to, like, if you wanted to leave a note for her daughters, share a memory, a laugh, or a thought with her family. We'll have it today and tomorrow. We wanted to be able to pass that on to her girls. So because this was her other family, we were her other family, and we know that from her. So so look for that on the table outside, or like I said, we'll pass it around and give you the ability to do that. And I'm happy to take any questions.
Thank you. Crystal? Or have it?
That's announced after you. Hopefully she didn't turn that off. Yeah, that's over.
All right. So I have several updates for everyone to discuss today. I'll start with the Stop the Bleed program. So we had our most recent application period was in June. That was a very successful application. We had over 1,300 kits that were requested. And if you'll remember, the applications are going to be open 4 times a year. We'll take applications for a month, and then in the following 2 months, we order and distribute. That also gives the RTAC coordinators time to conduct any training. Remember, we won't distribute any kits to anybody that hasn't been trained in how to effectively use them. So we might be calling on y'all to help us with some of these classes as we continue to kind of wrap those up. We did see really great success specifically in Region 8 that had over 400 kits that were requested. And I think they've done 13 training courses so far with the various different departments. So really strong work out of that region this quarter. Another change that I think I've discussed before, but y'all are going to hear me kind of go over this part for the next couple of meetings, is that all of our new kits that are distributed are going to contain a QR code in the directions. That QR code has about 5 different questions, and we ask people when the kit is deployed, when it's been used, if you'll complete that. Several reasons. One, we want to celebrate that we got a kit at the right place at the right time, and it was available to be used. We also are asking questions about what was used specifically out of the kit. We've got a lot of different pieces of equipment in there, and I think consistently we're just using the tourniquets out of them. So we just want to data mine that a little bit, and then of course be able to have a little bit better idea about how frequently they're being used and in what location so that we can target those for future distributions. The EMS Educational Needs Assessment is going to be coming up again this year. We can expect that survey to be distributed. October, November is kind of what we're targeting for it to go out. Last year, we had over 1,200 responses, and we really got tremendous information from the surveys and the subsequent reports. It's really been driving a lot of the efforts of the RTACs with their various trainings. So expect that again, and we certainly appreciate everybody distributing it. We had 3 different surveys in that. It was one for our EMS providers, one for our EMS leadership, training officers and directors, and then another one for hospital administration and ED staff. Really a lot of important information that we gather. So we appreciate your support in sharing that again this year. And now for our RTAC updates. So lots of really exciting changes that we have in the RTACs right now. We've got some leadership changes, but I really am just going to go over each of the different regions and highlight kind of the big efforts. So Region 1 has hosted a pediatric trauma skills training that came directly from a request in their educational needs assessment for ongoing pediatric support. They're running a PI project out of their RTAC, and they've had over 300 submissions for case evaluations that they're doing reviews. It's been a really great way to partner up hospitals and EMS services to kind of target education, and then also just kind of create some really great dialogue between the services and the hospitals. So Scott's doing a great job with that. Region 2 is expanding their EMS pop-up skills. This was also as a result of their educational needs assessment. And what they're doing is setting up training mannequins for needle decompression, difficult airway in the ER bay. So the idea is to bring the training to the medics. Consistently, we saw in our surveys that if they're not on shift, they're probably not seeking out a lot of additional training. And we had some high acuity, low frequency skills like needle decompression and intubation that everybody requested additional training on. So several other regions have kind of taken up that project with really great success. So if it's not something that's happening in your region now, let us know. We'll make it happen. Region 3, their most recent meeting was actually an MCI tabletop that was very well received, again, from their educational needs assessment. That was one of the most significant needs that they had or that was addressed in that survey was MCI training. So their RTAC meeting, they partnered with Region 5 and did a multiverse, and they used the protocols for MCI from both the EMS services, fire departments, and the hospitals, and had a really great training and then debriefing and after action. So I anticipate that we might see some more of those across the state because that one was so well received. Region 4, excited to announce Rachel Hand, who I know is in the room. Rachel is our new co-coordinator for the Region 4 RTAC. That's a first for us, and we are really excited to have her join the RTAC team and the amount of resources and information and excitement that she's going to bring to that. They are also working on their trauma symposium and a tabletop for the fall. Region 5, I don't think that any of us can keep track of Crystal, right? I think we can just say Region 5.
It's an army.
It really is. It really is. They recently had the Stop the Bleed training blitz that was done online. The last I saw, I think she had more than 1,000 participants in that training. They continue to do exceptional work with their multiverse. They have the honors program that's just been really great. And several injury prevention initiatives addressing teen driving, firearms falls, and child passenger safety. Region 6 is collaborating with Augusta University EMS physicians on a field blood program concept. They're currently collecting information and support to hopefully roll out support for pre-hospital blood initiatives soon. They continue to stop the bleed efforts in the schools and with the various EMS partners, and education and PI committees are showing increased momentum, and they are rotating the RTAC meetings across the region to hopefully garner a little bit more support from the EMS partners. Region 7, so many of you, Brian used to attend our meetings regularly, and Brian has decided to step down, Brian Durrani, as he prepares for retirement. And we're very happy that Paula Carter has now joined as the new Region 7 RTAC coordinator. She's been a longtime EMS provider and administrator and has worked as an educator in the technical college system. We're very happy to have her join the RTAC group. Region 8, we have a new coordinator there, Ben Whitten. And last week they had their first RTAC meeting in that region in person in a very long time. They had, I think 20 of the 24 counties were represented from EMS agencies. I believe all of the trauma centers were represented, and just a good start kickoff meeting. They've established the 3 committees of education, performance improvement, and injury prevention, and we expect that big things out of them in the future. Region 9 also has a relatively new coordinator. Coy Tippins has been with us for several months now, but has his committee up and off the ground, has also established several new initiatives, and we look forward to hopefully a trauma conference out of them within the next year is a goal. And they're also doing a first course, they're calling it the Airway Rodeo. This should be pretty exciting. He has lots of plans for complicated airway stations and scenarios and simulation-based training. Region 10 continues to expand their pre-hospital blood program. They have added an additional county, and I believe to date they've had a half a dozen administrations over the last couple of months. Very successful program, very fortunate to have the partnership with the hospital who's providing the blood products. They also conducted the 3rd annual sports medicine conference with the University of Georgia. They did, of course, trauma-focused breakout stations and had some new ones from previous years where they were doing extrications out of the gymnastics foam pits and all kinds of different trainings with removing helmets and shoulder pads and gearing up for fall football. They also continue their injury prevention efforts through helmet safety, CPR, and car seat education. They have a new structure to their meetings that's bringing the PI and injury prevention groups together before the meetings in hopes to kind of get a little bit more activity out of those groups. And that's a lot of updates, so that's all I've got for you.
Yeah,
She wore you out.
But happy to take any questions if anybody has them about the RTAC or the Stop the Bleed program.
I don't have a question, but I just want to comment. I just want to thank you for your leadership and stepping in. Everywhere I turn, I hear your name. It tells me that you're out and about. So I just really appreciate that. From being from Region 8, it was very refreshing to have a very productive, meaningful meeting that I felt like everybody participated in. And I attribute that to your leadership. So thank you so much for that.
Thank you. I appreciate it.
Great. We picked the right one. It's waited a long time for her.
Thank you.
Just update on the contracts real quick. I forgot. Sorry, we've been so busy in contract land. The level 2 contract should be out
On the end of next week,
okay, end of next week. We have some, for burn folks, I need some help with some of the language for y'all for GQuip. So, if you're a burn center, please reach out to me. I need your help. And then, level 3s and 4s, we just went over yesterday, and everything has to be reviewed by the AG's office before it comes out. So we're hoping by the end of the month, because the 3s and 4s are a little bit less complicated. So I just wanted everybody to have like a little bit of an update on when to expect it. And we are trying as quickly as we can, but we just want to make sure it's right. We're good now. Thank you.
Working on burn for a
Oh, amen. Thank you so much. I knew you would come to the rescue. It's just some language things that I want to make sure we get right about your registry, and then how if there's national benchmarking that you participate in, we want to just make sure we capture that correctly. Thank you.
Thank you. Marie for the OTCP report update.
Here, I left it warm for you.
Stacy will be next.
Good afternoon, everyone. I'm Marie Probst from the Office of EMS and Trauma, State Trauma Registrar. I have just a few reminders for everyone. As Gina mentioned, please do your TQuip and GQuip downloads for January 1 through June 30th data before September 2nd.
And it's really important that you get those done early because ESO has distributed the 2025 state OAST update, and everyone needs to install that. However, we are recommending that everybody complete your TQuip and your GQuip downloads before you do the installation. So plan accordingly and have your IT department involved in advance so that once you submit the GQuip and TQuip downloads, you can install that update, and then you can move forward with the download to the Office of EMS and Trauma for image training. So about the image training patient registry import link, that link will open September 3rd. So when you have your update installed, you can do your download and import that on September 3rd. The next item is the EMS and hospital ID numbers have been distributed. I'll be updating those lists every June and December and distributing the lists by email to you through the DPH encrypt secure email. And if you're using the ESO new patient registry, your lists are posted to Basecamp. And I understand each user is responsible for updating their ESO patient registry themselves. The new ESO update that was just distributed should have the V5 hospital and EMS provider ID numbers updated. If not, I apologize, but I don't think there's anything I can do to make ESO update the V5 in that way. But the old EMS numbers and hospital numbers remain the same. But continue to let me know if you hear or see of a name change or a new provider that brings you a patient or facility has changed names. That's always very helpful, and that change needs to go in so that the ESO patient registry users know to go in and update their registry that way. The level 4 centers will that have a December 2025 site visit date will need to do their download to the Office of EMS and Trauma again by October 15th, so that Stacy and I can review the charts and pull charts for your chart review period, September 2024 through September 2025. So level 4s, keep that in mind. Try to stay on top of your Q3 calendar year data for 2025. The 2026 schema changes have been submitted to ImageTrend and ESO. The 2024 calendar year data has been compiled in the Georgia Trauma Registry Annual Report by Dr. Dan Linley, and we are looking forward to that release very soon. So the next and last little bit of information I want to share is about OTCPE. Everybody knows the purpose of the OTCPE and the burn form is to keep all of the centers on track because what you're reporting to us is in advance of what you would be reporting to GQuip or to Trauma Commission for your pay-based performance money. So we do track a couple of data deliverables, and I know everyone's familiar with what's in the report, but I wanted to let everyone know a few things. For the fiscal year 2026 Q1 report, 97% of the facilities submitted by July 31st. So thank you, everyone. And for the 2025 fiscal year, OTCPE reports 100% of centers submitted. So everybody's on track, rolling along, doing that timely. So we appreciate that. For the calendar year 2024 record closure rate deliverable, since we don't see your record closure rate in the image stream system, we rely on the week 5 data. So 95% of the facilities met that deliverable in calendar year 2024. And for the trauma surgeon response rate deliverable, the calendar year 2024, 93% of the facilities met that. So y'all are doing great. The one piece of information about the burn form that we get, and Liz, Gina, y'all may be interested in what we have compiled. The OBCE burn center data has been compiled for fiscal years 24 and 25. So if you're interested in seeing that aggregate data, we'd be happy to work with you on that. That's all. Thank you. Any questions?
Can I add one more thing that just
Marie reminded me while she was at the the 2026 data dictionary. We know it has already come out from NTDS. There were not huge changes, but please go ahead and eyeball some of those. There's been a few definition changes and addition to some fields. With that, once that comes out, we can start working on the GWIP data dictionary. ESO is transitioning how they do the data dictionary, and they really ask for none or very few changes. And I had emailed Marie and Kelly, the registry group, and we had already talked about the changes we wanted to make. There were going to be a few anyway. So really the biggest thing that we have done is just make the organ donation fields in your registry not required. So you can still use them, but they won't be required. So hopefully they'll remove the validation rules on that. I know we've had a lot of discussions about the challenges with capturing those fields. And we've been working with our partners at LifeLink who can provide us most of that data. So you can certainly still use the fields. They just won't be required. So hopefully they'll remove the validation rules around that. So that would move to a non-required field in the GWIP data dictionary. And that's really going to be the only change in the data dictionary for 2026. So I have sent those changes to ESO already. So we'll start working on getting the formal document. So you'll have it going forward. But I didn't want to let you know that. So thanks, Marie, for sparking that in mind.
Thank you. Next up is Stacy Smith for OEMS.
Good afternoon, everybody. I have an update from our Office of EMS and Trauma. I am Stacey Smith. I'm the State Trauma Coordinator. I first want to say congratulations to Wellstar North Fulton as they were redesignated and ACS re-verified. As Maria mentioned, Dr. Dan Lou is working on our 2024 annual trauma report. So hopefully that'll be published soon and y'all can look at all the data that we take. So some people think, well, what do y'all do with all this? But we like to put that report out and then y'all can see how everything stacks up and is organized. We're open to still schedule any consults for 2025. If your center is looking for any consultation or update for verifications and designations, if we can help with anything, if your center is struggling with a certain standard or a certain, deficiency that we can help you get through or be able to meet that standard, reach out to us, and we can also start scheduling 2026. I want to thank everybody that's working hard with ESO. We have heard that it's been a little bit of a struggle, so just hang in there. And we just want to know that you're heard and seen, and you're doing great things. We also are excited at Office of EMS to establish our System of Care Advisory Council. We had our first meeting at the end of July. and we're gonna meet quarterly. So this has trauma, stroke, cardiac, and pediatrics across the state. And I want to thank Dr. Todd, Dr. Dunn, Dr. Register, and Tracy Johns is assisting us in the trauma world. And we're hoping to bring all these collaborations together to improve patient outcomes across the state. We did touch, I heard people touching on the pre-hospital team that's doing, blood in the field. And the Office of EMS is working on a public facing map that will show where the blood products are available to enhance clinical decision making and maybe some collaboration with blood products. So I don't have a timeline on that, but they are trying to get that map where we can put it on our website and people can see who's doing what and where, and that might help some of the products not be expired and help with the budget on that. That is the basis for our office. And the next topic I wanted to talk about is our OTCPE reports. I thank everybody that reached out that wanted to add some things to the report. We asked if anybody had any suggestions or anything they would like to add or something that doesn't make sense or why are we reporting these things. So we took your suggestions and I just wanted to update the changes that y'all will see on Q1 that will be effective in the September 15th. I will also send an email to all the trauma program managers with these details. So on all 4 quarters, the changes, we've added the ACS or state designation expiration date. So you'll fill in when your designation or verification expires. The next change is diversion total hours for the year. So we do ask about diversion, but we just ask per quarter. So there's going to be a text box at the bottom that has a year-to-date count. So you would just add all the hours for the year. The next change is on our expert question. I want to thank y'all for doing that this year. That was a new tab that we added. So we're taking out, I think there was like 5 questions that revolved around expert. So now it's just going to say, does your screening meet 80%? Does your intervention meet 80%? And then you'll upload that quarterly graph that just shows the tracking. So you won't have to upload the policy. The policy you might have to do on Q1 because we're trying to make the changes effective September 15th, but you won't have to upload the policy after that. And the last thing that's going to be on all 4 quarters is we're going to align with, this was a suggestion brought to us by one of the facilities with the new deliverable for the commission on VTE and hip fractures. So there'll be a question on, it'll just be bullet points. So you're already tracking it, you're already taking this data. So are you greater than 50%, greater than 40% or less than 40% on your VTE? So it's just bullet points to click. You don't have to upload a report to us. This is just keeping it on your mind each quarter. And then the hips, greater than 90, greater than 85, greater than 80, and then less than 80 for the 48-hour windows. And again, those are just bullet points for you to show where you are on each quarter. So those are all every quarter. Then the changes that are going to be on Q1 and Q3, we didn't want to put everything on every quarter. And and it turned into like a 100-page document. So on Q1, what we're adding, this was another suggestion, it's just a question for the levels 1 through 3. How are you using your TQIP data to improve patient outcomes and processes? And it's just a text box. So just to make sure that you're looking at your TQIP data and how are you implementing that in your PI program. And it doesn't have to be every single thing, but just some examples. So that way we know that you're looking at TQIP and you're using it in your PI. The other thing that'll be Q1 and Q3, disaster drills. And you would just put, have you had one or have you not had one that quarter? And then is the TMD, trauma surgeon, and the ortho surgeon for level ones attending their disaster preparedness meetings. Because I know there was some doctors that weren't going, and so this would kind of say, hey, we have to keep up with this every quarter to submit. And then, I mean, it's also a standard that has to be met for ACS. That will be your, one more for Q1 and 3, pediatric readiness. And these are just questions. It's a bullet question in a text box. So you don't have to upload any reports, but it's just what are you doing to be pediatric ready, focused, and any improvements you've made. And we did add this on level 4s. We know that that's not a standard in the Orange Book, but we don't know what's coming out in the new standards. But it's just to say if our level 4s showing focus on our pediatric patients that might come in that front door. So is there anything that your level 4 facility is doing to be pediatric ready? I know a lot of these get bypassed, they go to the higher levels, but if one comes in your front door, you want to make sure your staff is prepared, they have what they need to take care of that patient that just rolled in. It's not a ding or a deficiency, but it's just to put that in your mind. A lot of level 4s say that their ED department handles that. So that's fine. You can say ED director met with trauma program manager and they're pediatric ready. It doesn't have to fall on the trauma program manager for the level 4s, but we just want to make sure that our little patients are taken care of if they have to roll through the front door or if they have to make an emergency stop because they can't make it to the higher levels. And there's a text box and you can put in that text box, no new changes or processes if that's for that quarter. And just a side note, with our systems of care, we have a pediatric division and they are doing state designations for pediatric readiness. So that would be another way if when you're looking at these ED directors or whoever's in charge of pediatric readiness and they're like, we don't know what to do, we don't know where to go, we don't know what to do, they can reach out to April Moss or Sam in our office and they can go through the steps and be pediatric designated for pediatric readiness. And then the last change will fall on Q2 and Q4. It's already on Q4 and it's injury prevention. And this was just another suggestion that was brought to us from a facility. So you would just answer the same questions that are on Q4. You would just list some injury prevention that maybe has taken place in that first half of the year. And you don't have to upload the report. I know Q4 has the injury mechanisms injury report, but that's not going to be on Q2. It's just kind of a check and balance. That was kind of what we got on feedback from program managers was you're looking at so much and doing so much all through the year. Did you miss this one already? Or did you forget to check on this because you've been focused on something that was in your PI? So it's just kind of a check and balance every other quarter. And when y'all do the first one, if you're like, okay, this is maybe not what you were asking for, please reach out to me. We can edit it, we can change it, but we wanted this to be helpful to y'all. So that's why we asked for the suggestions at the end of last submission. So I hope this helps and helps your program. And again, we're there for you if you need anything. And if we need to revise it, we can. Or if you don't like the way the question is worded or something needs to change, just let us know.
Any questions for Stacy?
Sorry, I was going to speak this forward. I didn't have a question. I have one question. I know a couple years ago, there was a pediatric readiness statewide call. Are those still going on or did they stop? I wasn't part of it, our young director was, and she was under the impression there was to be an initiative and a push, and I didn't know if she got distracted or if it didn't happen. Do we have anybody know?
I know we're in that discussion too, we kind of with silent, so I don't know.
Was that from our office or is it with the?
I don't know, I can find out.
Okay, I know there's not a scheduled call with Sam, but I can follow up with April and Sam to see if they might want to reinitiate that to get more information out. But I do know I think we've designated 3 centers this year for pediatric readiness. I think they were all in the North Georgia region.
My notes, I probably have the email saved somewhere. I'll try to go through it and see if I can find it. Like, hold on. Can't remember who it was.
And
I know that our injury, our disaster preparedness person is the one that told me about it. And we had gotten a lot of information about it. There's a checklist that came with all of it. And it said, these are the things, if you're interested in becoming a pediatric certified center, these are the things you need to do. And so we started filling it out. And she said, you'll be getting communication shortly about that. I'm going to put your name on the list. And I never heard anything back.
That's exactly.
Yeah.
Marie, was there somebody before Sam? Okay. Well, I'll get with Sam in April and we'll find out some more information. Because I don't know if Sam was in charge of it or if that was a different person and then Sam took over. I'm not sure.
EJ was EMSC many years, but I don't know how far back you're.
No, this was like last year.
I was about, it's been since our console.
Oh, yeah.
So it's been.
Oh, yeah. I thought that's where it came from, actually. I thought that was part of the initiative. Hence, that's why I started reaching out to you, Kelly, about education, virtual education and stuff like that. And there's a program you had, I don't remember the name of it, that we could probably do virtually in our hospital. The other Kelly, pediatric Kelly. Yeah. That's why I reached out to you, because I was trying to line all those things up and then we just never heard anything back. So good question. Thank you for that.
Yeah, I'm not sure if that was Sam or not, but I'll find out.
I'm just thinking about, we were having sidebar on beach. We were having sidebar on beach readiness and how often hospitals complete that readiness to see where you are, where you come from. And it sparked that because our ER director was so excited after that call, because it sounded like there was going to be a lot of resources. And we kind of got stagnant where I am, just honestly, in moving forward. And so I was, probably question.
I think it's an important question. I think it's an important thing to talk, to look into further, maybe not now, because that's a huge focus for the ACS for verification. And for centers that are off in la land, where we have, not many resources for pediatric patients, I think that's an opportunity for us to kind of work on that together, maybe start a side group or subgroup or something to look at that and what does that look like. So, thank you.
Yeah, I think it's great, because adult centers get pediatric patients, where do you want them to go?
Yes.
That's good. Cheryl's up next for the Bloody Trauma Foundation.
Hello, everybody. It's good to see all of you again and spend a little time together. As you know, the reason the foundation exists is to invest in trauma care here in the state. And one of the ways that we do that is by awarding grants. And so we have some great news to share with you on today. The foundation will be awarding more grants. So we want you all to be thinking about projects for which you may need some additional funding. We'll notify you when the application period is getting ready to open. In the previous cycle, you'll remember we awarded 8 grants. We will fund 10 grants through this next cycle. The maximum award amount will remain at $10,000. We are also investing in trauma care by working with the Trauma Commission on the Stop the Bleed program. We're committed to helping find funding for the Stop the Bleed kits, and specifically our focus is on putting more kits on school campuses. We have some great news that, where's Crystal? That Crystal doesn't know about yet. We've been working with her. She let me know a few weeks ago that this first phase of the campaign, which focuses on putting more kits on high school campuses, that cost would be about $500,000. Instead of us waiting until we raise the entire $500,000, we are going to go ahead and put $100,000 into the program now. So we're excited about that. This is our first time raising money for Stop the Bleed. So we are excited about that first foray into the expansion and look forward to doing more with it soon. So we want to share that information with you all today. We currently have 2 projects that are underway that are key to education across the state. You all will recall that we have SEED, that's the continuing education instructors database. That's the one-stop shop that's online if you're looking for faculty for some of the advanced continuing education courses. We have been primarily focused on getting folks into the database that do ENPC and TNCC, and we also, well, let me back up a little bit. We have instructors in the database for 8 courses. What we have been primarily providing for instruction is using the TNCC and ENPC as part of our rural continuing education program. For those of you who are not in the database, we would love for you to be a part of that, because what we're looking to do as we go out and provide the rural continuing education program is to go into the database and find instructors who are in that specific region of the state where the course will be conducted. So what we would like you to do is, if you're not in the database and you're interested in being an instructor or a director, or you're qualified to do that, then please let me know, because we'd like for you to be a part of the database so that when folks are looking for faculty, they can call on you if needed. I mentioned that using the database is how we find instructors. One of the ways we find instructors for the rural continuing education program. Now, that initiative, you'll remember, provides continuing education courses for folks who are employed at critical access hospitals or rural hospitals, and we provide the courses for free. And to echo what I just said a minute ago, primarily the courses that we've been facilitating are TNCC and ENPC. We have done some RTTDC. We're getting ready to step up RTTDC offerings. And beginning next year, we are going to do ATLS. So if you are from a rural facility and you need that, and we can provide that to your folks for free, we would love to hear from you. If you've contacted us and said that you would like to host ATLS at your facility, we will be reaching out to you soon so that we can see whether we can make that happen. So that's good news, some additional course offerings. And just to wrap up, I wanted to share with you what some of our current needs are at the foundation. Part of what we do is we like to share stories about trauma survivors. And in so doing, not only do we tell their story, but we also highlight the trauma centers who took care of these folks. So for those of you who have some great trauma survivor stories, and they're all great, we would like for you to share that information with us. Sometimes we may just highlight them through our socials and on our website. There are other times when we may be able to call on them to participate at something that we're doing out in the community. We may use them and tell their story at a fundraising event that we have or at our annual gala. So we want to help celebrate the work that you all do within the trauma system. So please share those stories with me so that we can give you the recognition you deserve. We are also currently looking for board members with a variety of skill sets. So if you have someone you would like to recommend for board service, please let me know. We want our board members to come from all across the state. So that's no matter where you're located, you may know of some good folks who might be like-minded and focused on advancing trauma care who would be willing to serve with us. In addition to looking for board members, we are also looking for committee members. Our committees that we are trying to staff, so to speak, at this time are advocacy, fundraising and development, and program. We're also looking for those of you who might be interested in serving on our gala planning committee. Kelly. So, oh, that's right. I'll have to give Kelly 1 and Kelly 2. Kelly 1. Yeah, I really could use both of you, but For those of you who were at the gala we had most recently, thank you, of course, for participating and for being there. But you got a glimpse of the type of event that we would like to host, and we like to improve on it every year. So we're looking for some good gala planning committee members. Please reach out to me if you'd like more information. And the last thing is we are hiring a community engagement and development specialist. The job description is posted on our website. That person will lead our statewide outreach and awareness efforts. Any questions? Anybody want to donate while I'm here? See, I at least got you to laugh a little bit. Thank you.
Thank you, Sarah. Great information. All right, so next up, we'll go to our subcommittee reports. Julie Freeman, would you like to go first online?
I sure will. Hi, everybody. Reporting on behalf of the Education Subcommittee, I would like to echo Cheryl's sentiment. One of the biggest resources is our partnership through the Education Subcommittee. So if you're interested in learning more about participating as in teaching or participating as in hosting one of those rural trauma courses, it is a great place to get plugged in. In a second here, Lynn's going to put up the QR code. I keep the Microsoft Forms open at any time if you're ever interested in joining the committee. We do lots of good things. It's a good way to hear about opportunities for yourself and for your staff, and also just to connect and hear what everybody else is doing. So feel free to scan that, reach out. We'd love to have you. Our two biggest goals this year have been, one, we're working as a team to increase the amount of trauma certified nurses across the state. We all know that education and evidence-based practice is all roads lead to great patient care. So that's one of our goals, and we've had great strides. Grady's hosted several TCR and review courses to support nurses across the state in getting that. And we've even had a couple personal tests, or I should say successful certifications here at Keniston in the last couple of months. So we're very excited. So that's an ongoing goal. And then our biggest goal, which has rolled over from the end of last year, was acquiring STN onboarding modules. So as you know, if you're not familiar, they're made for trauma centers to use when onboarding new participants, especially for nurses. In learning about kind of the basics of trauma care in your center. They are customizable. Everybody in the state should have received an opportunity to sign up to those. If not, you can use this link or email me directly. But thank you so much to Gabby and Liz and Lynn and Kendra for getting that across the finish line. Gabby's made an amazing process of it being basically an automated sort of sign up. So reach out to her, reach out to me, and we'd love to get you plugged in if you're not already accessing those modules. And that's it from us. Thanks so much.
Thank you, Julie. Just to echo on the STN orientation modules, I did get on and download them, and they are really, really great. Love that they're customizable too. So thank you to the Trauma Commission for getting that for us. If you hadn't received them yet, please reach out because they are very good. All right. Next up, Kelly, pediatric.
Hey there. First off is SIPA, and we continue to offer a pretty good SIPA talk. We just did SIPA talk for Northside Connect, and I think it's really well received. So if any center anywhere in the state would like some more information on shock index pediatric adjusted, we'll be more than happy to connect you with somebody from our community to do the education. It's about a 30-minute educational series. Pediatric transfer 1-page reference is complete. I think it went out with the minutes. It's still in draft form until it gets the official state stamp of approval, which hopefully gets, but it was approved by all of the CHOA folks, all of the Augusta folks, and Dr. Lexi Smith. So we will make sure that if anybody, wants that, it goes out to your senators, if you need help, providing education, about these 2 pages, we'll be more than happy to give education about them. as well. Pediatric, transfer toolkit is to follow, so that's gonna be a kind of a more in-depth module, about pediatric injuries and pediatric transfers. And whole blood transfusion, Joe continues to be involved in the MADAC study, which is a study on giving whole blood to kids. And when we were talking just a little while ago about the EMS agencies giving blood pre-hospital and coming up with some kind of a database, I think it just crossed my mind. I think it would be helpful if we can add pediatrics to that database. 1 minute, one EMS agency saying they're not going to give blood to kids, and then the next week they are, and so we're not sure what we're getting when these kids are coming in. So if we can maybe add pediatrics to that database and communicate it often with the ped centers, I think it would be helpful. Pediatric readiness, we're always here to help. We're going to try to figure out where we stand on that. We kind of had a stand down, so all we've been saying is we're here to provide whatever services the state needs for pediatric readiness. So we'll be happy to take that over. It's what we find is needed. And then EMS Safe Transport Project, the PowerPoint is, the educational PowerPoint is finished and it's been approved. We're just waiting to put it on Georgia PowerPoint slides, and we continue to collect data using the QR code. We've not had many inputs from any other senators other than Showa. We do have a significant amount of EMS agencies that could benefit from education. We've had a little bit of a rough time getting our foot in the door, and having them believing that their crews actually are transporting kids in unsafe ways. So anybody has any ideas about how to, we can't force them to get the education, but we definitely know which EMS agencies would benefit the most. So if anybody has any ideas how we can get our foot in the door, just give them, it's a very quick PowerPoint, very concise education. We don't even have to go, we can just send it to them. We just need for them to get the education and start transferring kids.
I have a question.
Yeah.
Is there a potential opportunity with the RTACs that maybe when we have our RTAC meeting, we set aside some time to show the PowerPoint, like make that the education of the day for the leaders to maybe get it? And that'd be a way to kind of open the door to take it back to their services.
Yeah, absolutely. And I mean, as long as everybody can keep track of who's getting the education so that we have rosters, that absolutely. I sent the PowerPoint to Gabby and they were gonna look at everything over and then send me the GTC PowerPoint template. And as soon as it gets put on those PowerPoint slides, looks like it actually comes from the state and it's staffed by the state. I'll send that out to whoever would like it. You can have Gabby send it out.
I was ready for Crystal. I know she's done a study at her facility. I know she's done some education through our RTAC as well with the different agencies. I've been kind of out of pocket for my survey is Monday, so I've been kind of like not listening to all of that. But I do, if you want to reach out to her, she also had, or Josie, I know she's been on that too. About how to reach out to the area EMS agencies and outreach too. I know she's done a lot of education here recently. I don't know enough about talking about it.
One more exciting thing, with all of these releases, we wanted to make sure that the radiology toolkit, since it's not been updated since 2019, gets updated. So we just finished up a lit search today. Everybody in the group was kind enough to do 3 or 4 articles. So we had a good pool of about 24 articles that we're going to go through and make any updates to the radiology toolkit and be able to put the 2025 stamp on it and resend it out.
That would be great. I know that's very helpful. That was very helpful for us. We're still using. Do you have any idea when the one-page reference page, when that will be? I mean, is it still going through approvals?
No, it's through.
Oh, so they say it to be.
Lexi kind of was our last approval. She looked it over and approved it last week or the week before, so it just needs to get the stamp.
Well, that'd be great, yeah, because that is very helpful to, I know it'll be very helpful to a lot of other small rural centers. Don't treat these at all. Thank you. All right, next up is Raymond for process improvement.
Hi, everybody. So since our last meeting, we have not had another meeting for PI. We do have one next week. We continue to work on creating a playbook for our PI process. We've asked that people share things that work really well for you that someone else might could use, what you found in your verification visits that would help other people be prepared for theirs better. So if anybody has things, I'm still waiting for people to share things with us. I have things that I can share, but I'd also like to see what other people do. If you could share those things so we can get it this built and move on to maybe another project. But our next meeting is next Thursday from 11 to 12. If you're new and you want to be a part of that, just shoot me an email. It's Rayma, RAYMA .Stevens with a PH at northside.com, and I'll be happy to add you to our list and send you the appointment.
Thank you, Raymond. Kelly, the registry.
Hey, everybody. So we have two big things that have been going on in the registry subcommittee. The first one is the registry education courses for ICD Center. So all the centers got an initial request survey, signed up for either beginner, intermediate, or an advanced course. So we could get a group of like an estimated number. Then we worked with vendors. We came down to one company that we were going to use or are using. The beginner intermediate courses they're not in person, but you have to be, it's a 2-day course that you're attending. I'm assuming online. We have the dates for those for now. And then the advanced course is a virtual self-paced course. Along with that, we asked you about books and how updated your books were. So people expressed interest in new books. The commission funded both the courses and the books, so we greatly appreciate all of that. Thank you all for that. And Gabby has worked behind the scenes on this relentlessly with all of the updates, transitioning roles for people. I forgot to add this person. If you see her, or just shoot her an email about how much you appreciate her, because this could not have happened without her. And Katie's also been helpful in trying to get these POs. It's been fun. It's been a different experience for me because I've not had to do this before. So I can say that we are still awaiting POs. We are hoping that everything will go through in time, that the dates that we gave for the beginner intermediate courses will stand. We're waiting on a PO to be approved. So stay tuned if you are registered for the beginner and intermediate course, specifically the first course, you may want to pay attention to the emails that come out from Gabby. And I know Gabby's on the phone. Is that a fair statement, Gabby?
Yes. We are just waiting for the payment to go through. And once I hear from KJ Consulting, I'll probably just email everybody once the payment goes through, just to let them know that we're on board and they should receive communications from KJ Consulting.
So stay tuned on that. And both sides are working diligently, and we appreciate even KJ Consulting is we're communicating with them on a regular basis, trying to make this happen. The other thing is the books. So just like the PO is delayed or is taking longer than anticipated for the courses, it's taking longer than anticipated for the books. I hope to have the books here today and tomorrow to give to the centers, and that didn't happen. So we are talking about a plan B, which will be working with the company 3M to send the books directly to the centers. So once the center gets the amount of books that you need for your registrars or all of the people that are registered for your course, it'll be on the center to get those books out to those participants. So we do appreciate the funding for all of that. Stay tuned, pay attention when you see emails from Gabby. The second thing that we have been doing is looking at all the different registry vendors. So I asked in our registry subcommittee, which typically has between 150 and 180 people on it, for some participants that we wanted to look at different vendors. We ended up with 35 people. And we looked at 5 different registry software systems. Once that group of 35 gathered back together after we all looked at the 5, we eliminated it obviously down to 3. And from there we broke up into smaller groups and are doing deeper drill downs into ImageTrend, ESO, and V7. So all of those groups are spending more time with those vendors, and I hope to have a clearer summary of those 3 by the end of this month. Lynn and I talked about whether to do a big thing in the GCTE meeting about the different registry software systems, but honestly, we're not ready yet, and we didn't think this would be the right time for it. So just know that we're looking at all 3 of those systems, and I appreciate the people for taking the time out of their normal job to drill down and ask tough questions to these vendors to see what would work best for different centers. That's all I have.
Thank you, Kim. And thank you all for all your hard work. I know that is a lot of work, looking at all those different vendors and narrowing it down to those 3. I think is great. So we all appreciate you.
One thing, well, I will, Liz, this was something, and Gina, and even Marie, this is something that came up, and it's not something we need to think about right now, but we were talking about with the staff turnover, the vendor updates or upgrades. Should we consider moving forward with the commission budget, some sort of annual money provided to the centers, whatever software system they use, for some sort of registry specific education? Like, I know the annual maintenance fee and all of that is part of your funding. Should there be something in there about training or education or report writing or whatever? Because our transition is such that a lot of people are struggling even with the registries that we've had for years.
I would say, I think it's a great idea. I would put together a proposal. In fact, I was going to say now is probably a really good time for you guys to think, because, Lynn was mentioning, the modules that we just purchased, and that's just such a huge bang for the buck. Plus, I would just look at education in general, because now STN also has the Advanced Trauma Program Manager course out, the course for med-surg nurses, like orientation course, that's been piloted, and that'll be ready to go live soon. So that might be helpful for people. That's going to be a virtual course. And we haven't had a topic in an optimal in a really long time. So these are things that I've been thinking of, but until you brought that up, I never really. I would maybe the group of you, the committee chairs, need to get together and kind of determine what might be a good education budget for something. For just do a general. I hear Crystal Shelnuck's really good at education needs assessment. But she loves the women. She's yeah, I volunteer her. No, but seriously, I think it's easy because we, we all have that many centers that we can't like figure out what people want, and then. But we could, that also goes on with Dr. Vaccinated here yet, but for the TMD group too, like maybe we haven't had a TMD course in a while, like we really need to think about what other courses we need to do and get an education budget together, you know, for things like that, so. You know, it was a good time to start putting it all together.
Yeah, thank you. So Crystal, cannot be here, but I'll give her injury prevention report. So they did the Georgia State Safe Week, July 21st and 27th, all different centers being involved in that and bringing it from their center, getting a lot of education out on gun safety with that. Very successful. Already mentioned the Stop the Bleed, back to school training event that was held from July 28th to August 13th. And last I heard, there was over 1,300 participants throughout. So that was very good too. And on July 3rd, they had a virtual matter of balance coaches training held, and they had 11 participants attend that. And then they're gearing up for many injury prevention events in September, because that's fall prevention, suicide awareness, child passenger safety. It's a month for everything. Kind of like me. It's very busy. So they're in the process of gearing up for next month and all those activities. All right. Any questions on any of our subcommittees before we move on? Okay. So next up, we have our NCS standard review. So the first one that we was going to look at is the 2.12 injury prevention program. You have that slide there. There's a pediatric one pager. It's actually two. Yeah, it's probably So this, while she's getting the standard for this, so this is a type 2 deficiency, and it's applicable to all levels, 1 to 3, and all pediatric trauma centers 1 and 2. So you see there definition requirements, you have to have a designated injury prevention professional, you have to have at least 2 activities over the course of verification cycles, specific objectives and deliverables, but just separate major causes of injury in your community, and then evidence of partnerships with community organizations. Level 1 trauma center, the injury prevention professional must be someone other than the trauma program manager. And our lower levels, it's the trauma program managers, that's just their extra hat, and level 1s have to have a designated individual for that. And then, you know, when you get ready for your survey, you have to have a job description, you have to show graphs, come from your trauma registry, which your 3 most mechanisms of injury is, and then you have to show what you've done for those mechanisms of injury. And then have any educational posters, flyers for those. So it's a lot of work. And we asked Crystal and Justin, I don't know if anybody knows Justin Keaton is the new co-chair of the injury prevention subcommittee with Crystal. So he's going to come up and share what they do. And he's from Henry.
Correct. Hey, everybody. So, like she was saying, I'm from Piedmont Henry. I am a co-chair of the injury prevention subcommittee. Me and Chris Clark working through a few details as we're kind of defining that role for me. Lynn invited me to talk about the things that we do for community outreach and injury prevention. It's kind of been ever evolving. I started this as the PI coordinator for our hospital, and took on a little bit different role and then became the program manager. And as I've done that, there's opportunities that we found to participate with the community, and especially with fall prevention, I found it's a big one. As an ER nurse for me, that's a big deal because the majority of our registry patients and the majority of patients that we see are falls. So a couple of things that we did to leverage our injury prevention to meet the standard. And if you don't do it in your facility, I highly encourage you to partner with your public relations and communication teams. We got together with our communication manager, and about every other month, we have him run something in our local newspaper, either distracted driving, hands-on CPR, we did one on drowning prevention, and then upcoming, will be the child passenger safety information. So that week is September, the week for that is September 21st to 27th. So I sent him some information and he's going to run an article on that. We've seen an uptick in unrestrained kids or poorly restrained children. So that's something that we decided to kind of hit as a hot topic, especially with our center being right up 75 in Henry County. We do see a fair amount of car accidents as well. So those are things that you can do at your center to leverage your community relations and try to reach a little bit broader group of people than you may have got initially. They talked about the matter of balance training. I did go through that coach course. It was very good. We're actually going to start our first class September 4th. What we did is previously I went out to one of our senior centers and talked about stroke care and discussed medications. And they had a lot of questions about, balance and what medications that make people dizzy. So I leveraged that relationship and was able to set up teaching those classes there. And we're going to rotate to our senior centers. So once we get these courses done, so I think that is a very good community. And actually our OR manager is actually going to put both of her parents in. So she found out about it, so she's put both of her parents in. So it's nice because we get, you get to touch even the people that you work with. So I think that's going to hopefully be very helpful. Stop the bleed initiatives. I know that's always a hot topic. We decided to do it every other month at our hospital now. We're going to host it in our education building. We're going to do it in the evening, the first Tuesday of the month at 5:30. So we also used our communication manager and he did a Facebook post. And we also did like a little bit of an online blitz, kind of sharing that. We actually got a couple of people from our different Piedmont facilities that came and attended that course. And then several people from churches that are participating in their readiness groups with the churches. So I thought that was kind of an interesting mix of individuals that may not have originally considered taking a stop and bleed course somewhere. We do, I create a bunch of handouts, so I go and I'll make information and do handouts, like they were saying, sharing those flyers and things that we pass out at our events. We attend 2 large events a year for the hospital that I've been doing for about 3 years now. One is a large trunk or treat, so it's a great place to hit parents with pediatrics, and we give out gun safety information. We'll give out car seat information. We actually brought a couple of motorcycles a couple of years ago, brought all of our riding gear with us and did a discussion on rider safety and why it's so important to wear gear. You see a lot of motorcyclists that aren't properly wearing all their gear. They may not be wearing gloves, may not be wearing proper boots. So those are things that we discussed, especially some I was in a motorcycle accident a few years back. So for me, it was, applicable, and I was able to share some firsthand knowledge on that. So those are kind of the big things. So we have a couple upcoming things. Like I said, the matter balance courses, and then we're going to be doing the new stop and bleed things. And then, like I said, just partnering with your communication, your public relations team to your hospitals. They'll get you tied into a lot of events. Our public relations person bringing you all kinds of events to attend. So me and her work pretty close hand in hand, and we do attend quite a few events together, which I think is good for getting information out and then getting out to the public and being able to share the things that we have knowledge on that hopefully we can do to prevent injury.
Thank you. I think one of the things that the ACS is asking for is the measure of evaluation of outcomes, which is really hard to try and say, oh, we prevented these types of injuries, especially where we're just starting to move into some of the falls education, falls prevention information in the communities. So we don't really have a long enough period to be able to look in communities and say, oh, we've, for the 4 years before we implemented matter of balance, we had, a per capita fall rate of 8% or whatever. So as opposed to after being able to follow for a period of time where we've implemented these falls courses. Is there anything that some of the centers in the state are doing to be able to really track some of the outcomes of the interventions that they've found good luck with? Because I think that's the thing that a lot of us are kind of scratching our heads with, saying, okay, it's great to do these efforts, but how do we really measure at this point how effective our work has been?
Well, to dovetail into that, I was gonna ask if any centers had a template of any sort, that, because it asks for does it ask for. So let's take your top mechanisms are fall prevention or falls and then indexes, or let's just say. I mean, what kind of template or report are people doing to show, okay, falls are our biggest, our objectives are to get in community to implement fall prevention activities to whatever they are. And then this is that these are the activities that meet those objectives. And then how do you evaluate? So it's the bigger, I'm trying to figure out how to do that just in listening.
Ashley, can you come up to the microphone?
I don't. Thank you. I'm talking with your friend.
Yeah.
Yeah, so one of the things that we're working on that Kendra knows about is, that's one of the biggest things is how do you show in the data that you're doing it. So one of the initiatives that we've come up with is doing inpatient injury prevention because falls is our number one. So starting in September, our injury prevention person will be rounding to all fall patients. They'll be putting in a note that we can flag. And then one of the ways we're going to try to see if we make any difference, we're going to get a 5-minute exercise routine education on it, a falls booklet that has a bunch of information like checklists, how to change your house, that sort of thing. And then we're gonna watch if they get pre-admitted, because we have a lot of readmissions due to falls. So we're gonna try to see if these things that we put in place, on top of some other things, but we wanna try to see if that maybe reduces our readmissions related to falls for these patients. That's one way we thought to come up with the measurement. So that's one of the things that we're doing. That's probably not original, but that's what we're doing.
Actually, thank you. I think that's a great way to really look at some of your outcomes-based outcomes to the interventions you've done. Jessica.
I'm going to steal that idea. Our injury, Jessica Mann, Northeast Georgia Medical Center. So our injury prevention professional is about to start rounding. So tagging the patients, we'll just add that on. Jenna, I know she's on. The other thing that we're doing is the objectives for the amount of bounds and from bingo sides. We're really taking those because we searched we're preparing for our survey. We searched the data to see, do we have a decrease in falls? That's really hard to see. So I'm like, well, let's look at the data from the courses because it asks you, there's follow-up surveys on there. Have you had experience with fall in 6 weeks? And so that's kind of what we're doing, and our objectives for falls are non-broad. It is the objectives for each of the courses. It's just an Excel spreadsheet. So if you reach out to Jenna Howell at NGHS, it's jenna.howell@NGHS.com. She would love to share that input with you.
That's great. Thank you so much. I think that's always the hardest part, especially when you're preventing something from happening. It's really hard to quantify how much of an impact you're really having. So, all right.
Kendra, I had a thought. So as we're teaching the classes, we're keeping class rosters, and a majority of the people that we will be working with are in our communities. So maybe looking at our class rosters and following those patients for a little while and see that they experience fall post-class, and just see if it's effective or not.
That's a good idea too. Thank you, Justin.
That's very hard. So appreciate all the feedback. That's my survey Monday, and that's what I do. The video signs, the pre post, I just use that because I don't have it when they get to me. So hopefully I'll let you. All right, the second standard was to look at is 4.22 ophthalmology services. This is also type 2 deficiency. Yeah, there it is. This is applicable to level 1s and 2s and pediatric trauma center level 1 and 2. And we invited Jamie Van Ness to talk about this, because this was a big topic in their survey last year. Jamie, are you on?
Yes, hey Lynn, hey Kendra, hello everyone, thanks for having me. We went through our ACS verification under the December 2022 guidelines, so we unfortunately did not get to reap the benefits of this ophthalmology update that they recently released this summer. So when we underwent our verification visit, we had 10 days routinely uncovered every month. And I know that ophthalmology services is something that, you know, it's not unique to our center at Kennestone. You know, I've heard of several centers across the state of Georgia and across the country that really struggle with this as well. So when you are, I mean, we, in looking to meet this standard, looked at every way possible we could get creative through teleophthalmology, through employment of physicians locally, through contracting physicians to be on call who really had no desire to be on call. It was quite an extensive and exhaustive search. And the best that we could do was 20 days of coverage a month. So at that time of our verification, we provided the 12 months of call schedules, which now looks to be 3, but they can ask for more when they come on site. Our contingency plan at the time, we had an ophthalmology guideline that kind of walked through what the patient care management for somebody with an eye injury would be. And our contingency plan in the event that the patient required the services of an ophthalmologist after stabilization would be transferred out. And our contingency plan was to go to another level 1 trauma center with ophthalmology coverage. We showed them a transfer agreement. We showed them all of our documentation, and they were not happy with that. So we did end up getting a provisional verification based on this, and have spent a lot of time working closely with local ophthalmology partners on obtaining coverage. And I am very pleased to say that we now have 24/7, 365 coverage, but that did not come easily. We had been struggling with coverage since September of 2021. But looking at the new standard, looking at what the PRQ is looking for, it's wanting those 3 months of call schedules. The ask is for no gaps in coverage. But now it's saying that you can have a contingency plan, and you need to provide reports of transfers out for eye injuries. And I'm sure that they will walk through the performance improvement activities you did around those transfer out reviews. And then it wants a description of what your model of coverage is for ophthalmology. So with that, Lynn, I will pause to take any questions or hear any feedback from the group.
Amy, thank you. As you pointed out, there was, certainly there have been updates to the standard from the July 2025 release. And I'm grateful to see that those changes. I think it certainly reflects the current state of ophthalmology availability for a lot of hospitals now. But it's a challenge. It's a challenge having the constant access to ophthalmology even for level 1s. So thank you so much for sharing your experience, and hopefully these updated standards are going to make things a little bit more accessible for programs.
Yeah, thank you, Jamie. We appreciate that a lot. Dr. Baxley, I know the TMD group is looking at this as well. Do you have anything that you'd like to add that could be helpful? Sorry to put you on the spot.
Nothing really to add. I just like to say thanks to Jamie for throwing their program under the bus. I know they didn't have a choice about the timing and what the standards were at the time of the review. But I think their issue is, incredibly widespread. And I think that's what the BRC discovered when they started doing the reviews based on that, the previous version of standard. So I appreciate the efforts they've gone through. I just to add where we are with that, it is a very similar spot. We've gone through similar things, and including teleophthalmology and actually pricing that out, what that would cost, revising what the offer for call pay that we were offering our local ophthalmologists, employing ophthalmology services from nearby areas to cover. I think a combination of all those things, we're hopefully right on the borderline, being able to fill out 24/7 cost schedule. So I jokingly said that I wasn't going to share this information with my hospital leadership, or maybe just not explain it very well in terms of that. Maybe a little bit of relaxation is needed, but yeah, I just, that being said, I just say thanks to all those that have gone before us in terms of that rigorous process and the previous version of the standard. So I think I'm encouraged too by the fact that at least the BRC knows what our struggles are and doesn't just focus on unattainable goals, which just seem to be for most centers.
Thank you. Yeah, so as a new center, I'm Brandy Fitzgerald with Phoebe. As a new center coming in and, being a difficult place to try to staff in the rural area, we were sweating bullets. I'm not even through the hospital under the bus, but we did have a hospital that we networked with that had a virtual option that they had used for their survey that actually worked well. So we're exploring that idea. It's a company that offers ophthalmologists on staff from a virtual perspective. They hire local ophthalmology techs in the community, which they've already hired some in our community. The techs come in with specialized equipment that will actually be there to perform the exam with the ophthalmology virtual, and then they'll make a decision whether or not that is a emergent case that needs to go somewhere, or is that someone we can follow up on the next one. So we anticipate starting that probably in October, November, but hopefully that's going to be a solution for us. That's great. It's good to know. Thank you for the information. Anybody else?
I do have a question. So is this strictly pertaining to level 1, 2, and 3? As a level 4 MTF, we do have full ophthalmology services, but it's for active duty only. But I'm just curious if these kind of standards is it going to affect us in any way with us being a level 4?
For right now, it's just level 1 and 2s in the pediatric level 1 and 2.
Okay, awesome. Thank you.
Does anybody know when the more standards will be released from ACS? Any updates on that?
That's
what I thought. I thought I would ask. Maybe one day soon.
We'll be at the fall COT meeting, so I'm sure they will make another announcement that will then come and go. I'm sorry. I'm spicy nice, right?
We're not me, so spicy.
So that brings us to our last and roundtable discussion. Does anybody have any shared experiences, celebrations? I think North Fulton just passed their reunification. So anybody would like to share their experience? North Fulton? Anybody else? Okay.
Sorry, I was trying to sneak out of the operating room. This is Libby, the trauma program manager from North Fulton. Are y'all able to hear me?
Yes.
So yes, we went through our ACS re-verification in June. It was my first experience with this process. Our reviewer specifically focused on
they were really heavy on NPI. It didn't matter what it was, whether it be neurosurgery response time, orthopedic surgery response time, or just general feedback. They were really focused on our performance improvement plan, making sure we were following it. And really, any findings that they had came out of chart review. So if I could have gone back and done anything differently, it would be dedicating more time to making sure the charts that I selected were pristine. But I'm happy to, anybody reach out if you have any questions or upcoming verifications, and I can give you more information or answer any questions.
Thank you, Lou. Yes, they like us. PI is always the big issue there. One, Brad, did you have something? Can't you say you do?
Hey, so I just want to thank you first, Kendra, for helping us, but we achieved our ATLS designation site. So we'll have our first inaugural class September the 26th and 27th. I'm looking forward to that. I know most of y'all know that my passion is rural health and rural medicine, so hopefully we can get some of these smaller hospitals in to do and take this class. So I'm very thankful for that opportunity, Kendra, and your mentorship on that. Thank you so much.
Really, that's just such an amazing thing for South Georgia, for access to education and training for physicians and APPs in South Georgia. So thank you, Dr. Kent, for your efforts and your passion to really drive and get BB on board as an ATLS site for the state. That brings the number of ATLS programs in the state up to 10, which is it's not enough still for the need, but it's great. We're making progress. So thank you for that. And I'm excited to launch you guys.
That is good. I just wanted to let everybody know that CHOA finally got reinstated as an ATCN site. So we'll be able to offer some courses for everybody. And then one other announcement is just earlier this week, so it's kind of last minute. Safe Kids received confirmation that they provide lock boxes and firearm safety education for the Fulton County Board of Health's back to school health and resource fair. And it's on Saturday, so if anybody wants to do some fun outreach, it is at the Adamsville Regional Health Center from 9 a.m. to 3 p.m. I'll see you there.
Anybody else have anything they want to share?
Lynn, I just signed for the ICD-10, of course, so.
I'll say her.
Yeah, sign the check. Thank you. That's huge. It's, thank you.
Anybody else?
Good afternoon. This is Nadir Burgess from Northside Hospital, Gwinnett. I'd like to share, we also went through our ACS re-verification. It was June 26th and 27th. We have not received our final report, but preliminary report was 0 deficiencies. And we did have a few recommendations that they shared with us. I would echo what North Fulton shared. Certainly focus was on PI, specifically those time-specific metrics as well through the medical record review. Again, the recommendations that they made were welcome recommendations, and we look forward to receiving our final report and then working through some of those.
That was great. Congratulations.
Thank you.
Well, we are 10 minutes over. We got started 10 minutes late, so we're right on. Do we have a motion to adjourn? Second. Thank y'all very much. The team meeting starts at 3:30 in here. Thank y'all. Thank you very much for coming and joining the line.